So we're going to give you 60 seconds each to run through yourself, who you are, a little bit about your company and opportunity, and again, maybe your superpower if you want to do that.
RapidAI is a AI-aided imaging diagnostic company. Provide that diagnostic. We also lead the care coordination thereafter, and also track those changes and track the patient management over time. We started in stroke. It's obviously a very acute condition. We migrated across the brain into more chronic conditions such as aneurysm. We've done hemorrhagic stroke. We're moving down the body as well into other conditions like pulmonary embolism, AAA, and other variety of other disease states. We're in over 2,200 hospitals today and over 100 countries. So again, excited to be here and learn about everybody on the panel.
Summarize the key message that you would tell in this very short period of time you have of your clinical and economic value propositions, and make sure you tell us if you're reimbursed or if you're just, an enterprise sale that's going to just fit into the overall economics, and explain that business model. So it's really ultimately business model that we're kind of going after here, as well as the benefits.
What you really articulated is very close to Rapid's North Star. And our vision is that any patient showing up at any hospital, whether it's the highest academic center in the middle of a city or in the most rural center in Alaska, that patient is going to get the best possible care and the best possible clinical support and the best possible decision making. And in order to do that, you really have to recognize that not all hospitals are created equal. So in other words, that hospital in rural Alaska is going to have different imaging capabilities than that academic center. And that's really where we've developed algorithms and technology where our AI can work with non-contrast CTs, where most hospitals have it, very simple, to the most complex advanced imaging, including MR. And that way, we've really focused on enabling every hospital, no matter what the status, no matter where the location, can be connected to AI. And when you're connected to AI and you're shared immediately within PACS and all the information is shared within mobile, you're connected to the interventionalist, you're connected to those experts so they can support those patients in those rural spokes to see if there was an immediate transfer that's needed or an intervention that's required. And really what you do there is you're changing clinical decision making. You're enabling patients who wouldn't otherwise get an intervention or a transfer to get that faster and to get that better care. And that, not ironically, works better for the hospital system as well. So the hospital now, instead of calling, they're able to look and see the images, so they make decisions faster. So we take friction out of the system, enabling people to do their job faster. And by getting those incremental procedures, the hospital system is benefiting as well from an economic standpoint. The spoke also benefits because sometimes the transfer isn't needed. So they can keep that patient in their four walls, close to their family, keep that DRG there, and keep the people satisfied by not having their family move around so much. So from a total cost of care standpoint, we have a huge return for the hospitals. We are a SaaS subscription model. It's yearly. But we do actually, because we actually have focused on not just triage, but also quantification, characterization, tracking over time, that requires heavier FDA clearances. So instead of just what's called CAD-T, which are very simple, we're also in the CAD-X category, which is diagnostic. So that actually qualifies for reimbursement for some of our modules, such as aspects, which is an aspect score for stroke, hyperdensity, which is a quantification for volumetric hemorrhages for obviously trauma and hemorrhagic situations. So we always sell on the cost of care, the total cost of care, and the efficiencies that we bring. Hospitals buy it because of that, but we also do have reimbursements because of our dedication towards supporting decision-making with heavier requirements from the FDA. And we try to fulfill those because we think that's the best way we can support clinical decision-making.